Hey y'all, my name's Jessie, and today I'm going to be talking about positioning and image analysis of the axial calcaneus projection. When positioning for the axial calcaneus, first you're going to place the patient in a supine or seated position with the affected leg fully extended. You're going to center the heel to the image receptor, position the ankle in an AP projection. Dorsiflex the foot until the plantar surface is perpendicular to the image receptor, and then you're going to place a 40-degree proximal angle on the central ray. The central ray is going to be centered to the midline of the foot at the level of the fifth metatarsal base. Longitudinally and transversely collimate to half an inch of the heel skin line. When viewing an axial calcaneus image, you should see the talocalcaneal or subtalar joint space open. The joint space is demonstrated as an open space as long as the central ray is aligned parallel with it. The calcaneal tuberosity should also be demonstrated and with minimal distortion. Both of these will happen if the foot is aligned perpendicular to the image receptor and a 40-degree central ray angle is placed with the joint space. The distal metatarsals should not be demonstrated on the medial or the lateral aspect of the foot. This can be avoided if the foot is perpendicular or straight up and down to the IR, not leaning to either side. The sustentaculum tali should be in profile, and the proximal calcaneal tuberosity should be in the center of the exposure field. The image to the left demonstrates all of these qualities. The talocalcaneal or the subtalar joint is open. The calcaneal tuberosity is demonstrated with minimal distortion. The distal metatarsals are not demonstrated on the medial or the lateral side of the foot. The sustentaculum tali is in profile. And the proximal calcaneal tuberosity is in the center of the exposure field. In this image, the foot appears to be insufficiently dorsiflexed. The central ray is aligned closer to parallel with the long axis of the tuberosity instead of the joint space, causing the tuberosity to demonstrate excessive foreshortening and the joint space to be obscured. The foot should be more dorsiflexed, or in other words, pop the heel out to achieve that 90-degree angle to the image receptor. On the other hand, when the foot is excessively dorsiflexed, the joint space is closed, but the tuberosity will then be elongated. Also, to correct this issue, the foot should be dorsiflexed until perpendicular to the image receptor. Another common mistake made when performing the axial calcaneus is rotation or tilting. If the leg is externally rotated or the ankle is everted, the fourth and fifth metatarsals are demonstrated laterally, as demonstrated in the image that I have provided. If the leg is internally rotated or the ankle is inverted, the first and second metatarsals will be demonstrated medially. In this image, the fourth and fifth metatarsals are demonstrated on the lateral aspect of the foot. The ankle was externally rotated or the foot was everted. To correct this, internally rotate the leg until the ankle is in an AP projection, or bring the foot to a neutral position without eversion. I have provided a few quiz questions to review the content we just covered. Number 1. The talocalcaneal or subtalar joint space is obscured and the calcaneal tuberosity appears foreshortened. How would you correct this? A. Dorsiflex the foot more until perpendicular to the image receptor. B. Plantar flex the foot more until perpendicular to the image receptor. C, do not change anything. D, rotate the foot laterally. The correct answer is A, dorsiflex the foot more until perpendicular to the image receptor. Number 2. The fourth and fifth metatarsals are demonstrated laterally. What mistake was made in positioning? A, the leg was internally rotated and or the ankle was inverted. B, the leg was left in a neutral position. C, the leg was externally rotated and or the ankle was everted. D, the leg was not dorsiflexed. The correct answer is C, the leg was externally rotated / ankle was everted. Number 3, does this image meet criteria? A, yes, there are no positioning errors. B, no, the foot is insufficiently dorsiflexed. C, no, the foot is excessively dorsiflexed. Or D, no, the foot is rotated. The correct answer is C, no, the foot is excessively dorsiflexed. You can tell this because the calcaneus appears elongated and the joint space is closed.